In this special video presentation, 7 News anchor Mike Landis takes viewers along on his battle with prostate cancer. His journey begins with a diagnosis and travels through research and self-discovery to find the 21st century treatment he ultimately chose. 7 News and the Prostate Cancer Education Council have made this DVD available to the public in an effort to help educate and increase awareness about the technology and treatments available to those facing the same journey as Mike. Here is his story.
Hello, I'm Mike Landis, TV news anchor and prostate cancer survivor. If you're watching this, then it's likely that you or a loved one has been diagnosed with prostate cancer. This DVD chronicles my journey with the disease from my diagnosis in June of 2006 to the treatment I chose in July of 2007. This is my story. Hello, everyone. I was one of a couple 100,000 men diagnosed with prostate cancer in the United States last year. Nothing special about my case, pretty typical actually. Still, it was scary news, but not nearly as scary as the treatment options I was offered. When I was looking for better answers, I invited you to come along with me. This program chronicles my year-long journey with prostate cancer, a journey that began with a question: what do I do now? Now that I've been diagnosed with it, it seems like everywhere I look these days, there's some kind of story about prostate cancer. And while most men diagnosed these days won't die from the disease, I found that the side effects from the available treatments can be daunting. When a man's prostate is removed, or the cancer is frozen or treated with radiation, he can be facing possible incontinence or impotency.
It was funny. I think the first concern I had wasn't the cancer. I mean, it's like death was more palatable than incontinence or lack of sexual function.
More prostate cancer is being diagnosed than ever before these days because of improved screening and getting the word out.
He said, I've heard on television today's the day you need to come down here and get screening, so here we are.
Still, there are some men who have been slow to get regular prostate checkups by their doctor. The reason can be summarized in 3 words that make men squirm: digital rectal exam.
Drop your shorts and bend over, Mr. Babar.
Oh, no, really, we don't need to. We don't want to do that. You know, if I did some sit-ups in the morning or bent over like this, I'd probably feel 100% better. Moon River.
No, I think the digital rectal exam takes, a minute or 2, and along with the PSA is probably the best test we have for screening for cancer.
Dr. Michael Gloday of the University of Colorado Health Sciences Center tells me he's frustrated with the pace of prostate cancer treatment and research.
If Susan G. Komen Foundation is racing for the cure, we're crawling for the cure. We have a long ways to go in terms of awareness and also even how we diagnose the disease. We probably overdiagnose it right now.
Even the second opinion letter I received from CU Health Sciences Center on my prostate cancer diagnosis says, obviously we are all frustrated by the fact that there are not more definitive ways to advise patients who have low-grade, low-threat level prostate cancer. This is the Pathology report that confirmed that I have prostate cancer. I wanted to know what a lot of guys in my situation want to know. Do I need to do something right now?
Unfortunately, we probably overtreat some men. And I think the next wave of research will be trying to sort out the ones that are the rabbits from the turtles.
And this is where we're going to go.
You're looking at one of the newest tools being developed to find the rabbits, fast-growing cancer, and the turtle, slow-growing cancer.
So this is the future?
Hopefully.
Dr. Al Barkawi is Director of Research at CU Health Sciences, and he showed me an experimental computer imaging system designed to accurately pinpoint cancer in the prostate and monitor its progress.
We're trying to remove the cancer within the prostate, and we call that target focal treatment.
It's this kind of technology that brought breast cancer treatment from radical mastectomies, removing the breast, to lumpectomies, removing the cancer.
We find where the cancer is in the prostate, and we just treat the cancer. And it's kind of like, it's been called the male lumpectomy.
Dr. Dave Crawford tells me now that I've been diagnosed with prostate cancer, I need to step back, take a breath, and carefully consider all of my options, even if it's choosing not to choose right now.
In general, most of the time, you don't need to rush to make a decision. You don't need to rush to treatment.
Whew. Thank you, Doc. You ever serve time?
Breathe easy.
Breathe easy.
Last year, prostate cancer patients could choose one of a number of radical options. They could have a prostatectomy, that's prostate removal by a surgeon or robotic surgery. They could have radioactive seeds placed in the prostate in the area of the tumor. They could undergo proton therapy, high doses of radiation targeting the cancer. There's cryoablation, freezing the tumor and the area around it. But for guys diagnosed with low-grade, low-threat level prostate cancer, you could choose watchful waiting, PSA tests at 3 months, biopsies every 6 months. That's what I chose, and it drew a very interesting public response. People wrote and called me and they asked, "Are you nuts? Don't wait. Get that stuff cut out of you." Well, that got the journalist in me fired up. The more I investigated this topic, the more I realized that contemporary prostate cancer research and treatment seemed to be at about the same place breast cancer research and treatment was some 15 years back. But thankfully, there were some new developments on the horizon. One area showing great promise is a new prostate imaging technology being developed by researchers at the CU Health Sciences Center. It creates a three-dimensional look at the prostate, making it easier to monitor and then target the cancer.
I think the future is going to be that we're going to see a lot more of this and a lot less of the more aggressive therapies.
Better imaging combined with newly developed treatments would target the cancer in the prostate, eliminating the need for a prostatectomy, removing the prostate. It'll be a huge improvement, but not the ultimate fix.
Because imaging is going to tell us about the local nature of the disease in 3 dimensions, but it won't tell us much about the potential for the disease to have already spread at the microscopic level.
Dr. Michael Glodet says clinical trials are happening right now to find ways to detect who is at risk for prostate cancer and treat it before it develops. Perhaps someday with a simple vaccine.
New drugs that are related to that, and in some cases maybe even vaccines. There are at least 2 or 3 clinical trials with vaccines that have a couple hundred men in the trials that look a little bit promising.
Dr. Glodet also says the research is showing that hormone therapy could one day be as effective in treating prostate cancer as it is in treating breast cancer.
If prostate cancer turns into a disease that you can take a pill for once a day and you live 30 years anyway, that's a pretty good goal.
And what if there was a pill that had a microscopic technology inside that could go right to the cancer and kill it? Pretty interesting, huh? More about that a little bit later. In the meantime, there was progress being reported in newer treatments like androgen deprivation hormone therapy or injections like Lupron Depot that can shrink tumors. Even high-intensity ultrasound treatments, they call them HIFU. We'll tell you more about that a bit later as well. Still, I chose watchful waiting initially. But not long afterward, I found out about an even better choice for me. A 3-dimensional mapping biopsy procedure that combined a whole lot of needles and a computer program. That part of my prostate cancer story when we come back.
I'm General Colin Powell. Prostate cancer is the second leading cause of cancer death in men, and African American men are twice as likely to die from the disease. If you are over 40 and have a family history of prostate cancer, your risk increases. Let's beat this disease. Early detection is the best weapon we have against this silent killer. Talk to your doctor about prostate cancer and get screened. For more information about this disease, contact the Prostate Cancer Education Council.
Welcome back. When I was told I had cancer, the only thing more shocking for me was to find out about the possible side effects from the available treatments. Side effects like impotence, incontinence. Well, I decided not to decide on a treatment for a while, and it paid off. Deciding what to do next was easy when I learned about something called 3-dimensional mapping biopsy. It would not only find the prostate cancer, it would make the treatment more precise and more effective. I can't look.
That's the best part.
I'm such a wuss. This is the University of Colorado Urologic Oncology Center, where I'm getting my blood checked for its PSA level, prostate-specific antigen, and an ultrasound that will help doctors determine if I'm ready to have a 3-dimensional mapping biopsy. That's a step somewhere in between watchful waiting and aggressive prostate treatment or surgery. The doc said to make the procedure more effective with less recovery time, I needed to use the drug Avodart to reduce the size of my prostate. And it seems to be working.
It's dropped the size of the prostate from 79 down to basically 47 grams, so that's a marked improvement.
But not improved enough for me to get the 3D mapping biopsy just yet. I'm told it would go better for me if I let the Avodart work on the prostate size a little longer.
I would stay on it and see where we are in about another 6 weeks on the volume, and then at that time I'm almost sure that we'll be able to do the biopsies and we won't need to do as many.
I know what you're thinking. You're thinking, why would this guy go through all of this trouble when ultimately he may have to have the operation, the removal of the prostate anyway? The answer can be found in this modified version of a children's board game. You see, for guys like me with low-level, low-threat cancer, the idea of an operation means these are your choices: removing the prostate or essentially killing the prostate. Choices that bring significant side effects. And that's why guys like me are asking, why can't they just target the cancer and get rid of it?
When I first got prostate cancer, I thought that's probably what they did. They find where it is in your prostate, they cut it out, and you're done with it.
58-year-old real estate developer Jerry Lee of Boulder and his wife Donna saw my story on prostate cancer last November. In December, he was diagnosed with it, and he too was told he could do watchful waiting.
Because I was fairly early in the process, and but that's not really what I do. I don't sit around and wait.
Jerry and his doctor decided that he was a good candidate for 3D mapping biopsy. Not a brand new procedure, but much more accurate and effective than standard 12-needle biopsies.
I think this procedure allows them to take 30 or so biopsies, and I'll have a much better picture.
Okay. Which will allow us to pinpoint where is that cancer based on the results of the pathology.
Dr. Al Barkawi demonstrates how the 3D mapping biopsy identifies the location and the amount of cancer, allowing doctors to go back in with targeted treatment, attacking the cancer and not the prostate. In a number of cases, the mapping biopsy finds more cancer than they knew was there.
In this case particularly, we have advised the patient to go more aggressive based on the results we have on the mapping biopsy.
So while Jerry is under mild anesthesia, doctors take their dozens of biopsies, and based on the results combined with 3D computer imaging, Jerry and his wife Donna can make a better informed decision on what to do next. As for me...
So we'll see you in 6 weeks?
Yes, sir.
All right, so thanks very much.
Take care.
Okay.
Now, the whole idea of making an informed decision about treatment might seem pretty obvious, but you would be surprised by the number of guys I've talked to over the last year who never got a second opinion and then chose surgery or other radical treatments without being offered any other options. Now, the series of experiences that followed my original diagnosis of prostate cancer finally brought me the answer I'd been looking for, the answer to the question, what will I choose to do? I'll share that and how I made that choice when Prostate Cancer, My Story, continues.
Hi, I'm Tony Romo, quarterback for the Dallas Cowboys. My dad and I are very close, and I can't picture my life without him. So when I found out that he had prostate cancer, my whole life changed.
But when found early, the 5-year survival rate for prostate cancer is nearly 100%. Trouble is, prostate cancer may have no warning signs or symptoms, which means screenings are absolutely essential.
This year, it's expected that more than 220,000 American men will experience what my dad did.
We were lucky. My cancer was found early.
Talk to your doctor about prostate cancer screening.
More than 200,000 guys found out that they had prostate cancer last year, and I was one of them. And most all of us had the same question, what do I do now? My doctor said I could decide not to decide just yet, watchful waiting. Well, a few months later, I asked, what do I do next? I was looking for a more effective procedure to find and evaluate my cancer, and I found it. 3-dimensional mapping biopsy. And when the results came back, that prompted another question about treatment. What will I choose to do? Search the internet for prostate cancer information and you'll get 18 million pages. It's overwhelming, especially when all you want is for your doc to find and remove the cancer, not your prostate. Here's a what if for you. What if finding cancer was as simple as using some sort of a map quest for your body? I mean, what if it was just as simple as typing in, I want to find my cancer tumor, and you know that it's in your prostate, and you hit search. Of course, prostate cancer isn't that easy to find and treat, but 3D mapping biopsy comes close. Hi, Dr. Crawford.
Hey, great to see you.
Hey, listen, it's
Well,
great
everything
news.
went okay?
Oh, great news. I'm just tickled to death. Well, tell me more about what we're looking at now. But wait, before we talk about that, on April 13th, Friday the 13th, I had the 3D mapping biopsy procedure. It's usually 30 plus needles to pinpoint the location of the cancer. In my case, they went for 90 needles. Talk about pinpoints. And within days of my weekend recovery, this was the result.
As you can see, only one core out of 90 cores that we took from it in a systematic kind of 5 millimeter kind of grid, only one core showed a cancer.
And because they located the cancer by using that mapping grid, they can use the same grid to go back and just treat it. Hi, Dr. Crawford.
Hey, great to see you.
Hey, listen, it's
Well,
great
everything went
news.
okay?
Oh, great news. I'm
Yeah.
just tickled to death. Well, tell me more about what we're looking at now.
Let's talk about it.
Okay, so we're just going after the cancer. And, you know, in a way, this is like what happened in breast cancer years ago. Women went from total mastectomy to lumpectomy, or just treating the area of the cancer.
And this would be the male lumpectomy. Cryotherapy, freezing the tumor, is one option to accomplish this.
It's done the same day, you'll go home the same day with the help of a needle, an ice needle in this case, that creates an ice ball at the tip of it, targeting this area, as you can see here, based on the three-dimensional prostate biopsy.
More needles, great. But so far it seems to be effective.
It's really like a smart palm that will actually take out only the bad guy.
So 11 months after being diagnosed with prostate cancer, I decided to have the targeted focal treatment using cryotherapy. Last summer, I went in knowing that there were risks. I knew that there were no guarantees, but it was the choice that made the most sense to me. So, how did it go? What was the recovery like? Am I cancer-free now? All of those are good questions, and I'll have answers for you when Prostate Cancer, My Story, returns.
Are you just going to sit there when you could be at risk for prostate cancer? Come on. It's the second leading cause of cancer death in men, and African American men are twice as likely to die from the disease. And if you're over 50 or have a family history, your risk for prostate cancer increases. Don't just sit there. Talk to your doctor about your risk for prostate cancer. For information, visit pcaw.com.
So now I've come full circle. The prostate cancer diagnosis, the search for better options, the choice to pinpoint the tumor, the choice to freeze it to death. And that's where we pick up the latest chapter of my story. Hi, are you ready for me?
I'm ready for you.
Am I ready for you? That's what I'm not so sure about. This is deja vu all over again. The 3-month checkup after my targeted focal treatment for prostate cancer. Oh, you don't know about that yet? Well, here's what happened.
This is monitoring one of the needles that having been placed on the area that has tumor.
The answer to your question is yes, it is creepy to see yourself unconscious on an operating table. That said, by using the MapQuest type information from the previously performed 3D mapping biopsy, special needles are inserted into the prostate.
Right now we're starting to freeze, and what we'll see here is some ice in a minute develop.
The freezing solution sent through the needle lodged in the prostate forms an ice ball at the tip. That will kill the cancer. Great care is taken to do minimal damage to areas of the prostate around the tumor.
This is the area we actually froze, and this is the area we monitored.
And the whole thing is over within less than 2 hours. Recovery from anesthesia was reasonably quick, and I was out of the hospital and on my way home by 11 a.m., all in the same day.
Are you expecting the PSA to be down today?
It should be down, but not too much.
So on this first Tuesday in November, I'm getting the first of what will be 3 quarterly checkups before another 3D mapping biopsy at 12 months. That'll be July 2008.
Everything has gone great. It went the way that we would hoped it would from the beginning.
Dr. Dave Crawford is talking about the progress in my prostate cancer treatment, but the words are true for all prostate cancer research in the last year. Perhaps the most exciting thing on the horizon for prostate cancer treatment, nanotechnology.
Nanotechnology refers to very small particles. You can put a cargo inside these little particles that when they get to the disease or get to the area, they can deliver a payload. In prostate cancer, the payload would be something to destroy the disease.
Destroy the disease and not the prostate. That's the ultimate goal of this and all new treatments being developed.
The first thing you have to think about when you have prostate cancer is just stop, take a breath, and look at the options. There is no rush to do anything. Take your time. And one treatment isn't right for everybody. And I think that people should get opinions. They should not go to places where they just have one-stop shopping.
So, am I cured? Is all the prostate cancer all gone now? Well, I'll have another 3D mapping biopsy next July, then I'll know for sure. And even if it's gone, there's really no guarantee it might not come back. But in the meantime, I'll have PSA, prostate-specific antigen, blood tests every 3 months as a guideline to chart my progress. And what are the coming attractions in the fight against and the treatment of prostate cancer? Here are the headlines. The University of Colorado Health Sciences Center has been chosen for FDA trials on high-intensity focused ultrasound, HIFU. We were talking about that earlier. As it stands, HIFU can only be performed outside the U.S., and there are insurance issues, as in it's not insured. A urine test for prostate cancer has been a work in progress for some time. It's getting closer to becoming reality. And a recent study here in Colorado found that the drug finasteride, which is used in men with enlarged prostates, may also be a prostate cancer preventative. And the University of Colorado is developing a computer program using color Doppler and ultrasound to provide real-time 3D images of the prostate. That'll be a huge help in the diagnosis and the treatment of prostate cancer. It is pretty exciting stuff, and most of it evolving over the last 12 months. We invite you to check in with us on thedenverchannel.com at any time. Just go to the left side of your screen and click on the Mike Landis Reporter's Notebook title. For my blog and our other prostate cancer stories, you'll find all of those there. And please feel free to send your questions, share your experiences, rant your rant. I'd love to hear from you. You'll also find interesting links to a variety of sites that can offer additional information on prostate cancer awareness, research, and treatment. And one of the newest ones is www.alprostate.com. It's run by one of my favorite docs, Dr. Al Barkawi of the University Hospital. It has loads of useful information. So, bottom line, no pun intended, I feel great. No lingering medical symptoms of any consequences for me, but an acute awareness of how blessed I've been in this journey. Blessed by the incredible medical care that I've received, and blessed by the incredible caring of so many of you that you've shown through your calls, your letters, and your emails from here and from across the globe because of our website, thedenverchannel.com. And would you look at this stack of emails about the size of the yellow pages? We make every effort to answer each and every one. I thank you very much for that. And so, that's prostate cancer, my story. Remember, if you or a loved one is diagnosed with prostate cancer, take that breath Dr. Crawford talked about. Then get a second opinion. You'll be glad you did. Thank you for watching. Let me hear from you. So long. Here's the rest of the story, as Paul Harvey likes to call it. I went back in May of 2008 for a 12-needle truss biopsy, and the results show me to be cancer-free. I'll continue to keep tabs on my PSA. I'll have an annual truss biopsy for the foreseeable future. Am I cured? I have no idea. Could I get it again? It could happen. Do I have any regrets about my choice not to have radical treatment or removal of my prostate? Not a one. And what should you do? Well, ask a lot of questions, do a lot of research, get second opinions, and be proactive in your overall health and treatment. In other words, take good care of yourself. I'm Mike Landis.